This product is a multivitamin that is used to address vitamin deficiencies caused by inadequate diet, certain medical conditions, or pregnancy. Vitamins are essential for the body and play a crucial role in maintaining overall health. Make sure to chew these gummies thoroughly and swallow them, usually once a day or as directed by your doctor. It's important to follow all the directions on the product package or as directed by your doctor, and not to take more than the recommended dosage. If you have any questions, don't hesitate to ask your doctor or pharmacist. Taking these gummies regularly will help you get the most benefit from them. Try to take them at the same time each day to help you remember. Some possible side effects of women's daily gummies are constipation, diarrhea, or upset stomach. However, these effects are usually temporary and may go away as your body adjusts to the medication. If you experience any lasting or worsening effects, it's important to consult your doctor or pharmacist. Keep in mind that if your doctor has prescribed this medication, they have determined that the benefits outweigh the risk of side effects. While many people using this medication do not experience serious side effects, it's important to be aware of the potential for a very serious allergic reaction. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. If your multivitamin contains iron, it's crucial to keep it away from children as accidental overdose of iron can be fatal for children under 6 years old. If an overdose does occur, seek medical help immediately or call a poison control center. Before starting to take women's daily gummies, make sure to inform your doctor or pharmacist if you have any allergies to its ingredients or if you have a history of alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, be sure to talk to your doctor if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. This medicine may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor about using this drug safely. Before undergoing any surgery, make sure to inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this medication. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. It's important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure lab personnel and all your doctors are aware that you are taking this drug. If there is an overdose and serious symptoms like passing out or trouble breathing, it's important to call 911 or a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Be sure to keep all of your medical and lab appointments. It's important to note that these gummies are not a replacement for a healthy diet. It's always best to get your vitamins from the foods you eat. Make sure to maintain a balanced diet and follow any dietary guidelines given to you by your doctor. If you have been prescribed women's daily gummies and happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one. Don't take an extra dose to make up for the missed one. Make sure to take your next dose at the regular time. It is important to store women's daily gummies at room temperature, away from light and moisture. Avoid storing them in the bathroom and keep them out of reach of children and pets. When it comes to disposing of women's daily gummies, do not flush them down the toilet or pour them into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the correct disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.